Hello, everyone. I'm Lana Zach. Thank you so much for joining me. The U.S. may soon have another coronavirus vaccine in its arsenal. Johnson & Johnson released results of its phase 3 trials this week and says it soon plans to seek emergency use authorization from the FDA. Data shows its candidate is effective in preventing the most serious cases. And unlike the Pfizer and Moderna vaccines, Johnson & Johnson's requires only one dose and does not need special refrigeration. However, this vaccine does appear to be slightly less effective against the virus, and that is especially true in the variant first detected in South Africa. Dr. Anthony Fauci says this should be a wake-up call. The president's medical advisor warns the virus will continue to mutate, and cases linked to new variants may eventually outnumber those of the original strain. The solution, he says, should be speeding up vaccinations. As of Friday morning, nearly 28 million doses had been administered in the U.S. More than 49 million doses have been distributed. The National Guard has been dispatched to assist with vaccination efforts in 26 states. Total infections in the U.S. have now climbed above 25.8 million. The nationwide death toll stands at more than 435,000. Mola Lenghi begins our coverage from New York City.
Well, the U.S. will soon have a third vaccine to add to its arsenal in the ongoing fight against COVID-19. But that promising news does come with some concerns.
Tonight, Johnson & Johnson's single-shot COVID vaccine is injecting more hope in the race to vaccinate America.
I think there's no question that this vaccine is going to be a game changer.
Data from the U.S. trial of Johnson & Johnson's vaccine shows 72% efficacy against moderate and severe infection and 85% efficacy in preventing serious symptoms in global trials.
It either will stop you from having COVID, or if you have COVID, it has a much milder course, and it'll stop you from needing to worry about ever getting so sick that you have to go to the hospital or dying.
But there are concerns tonight over Johnson & Johnson's less than 60% efficacy in South Africa. That variant is now in the U.S.
This is a wake-up call that we will continue to see the evolution of mutants. So that means that we will have to be nimble to be able to just adjust readily to make versions of the vaccine.
The struggle to get the vaccine into the arms of Americans continues nationwide tonight. In West Virginia, pharmacist Krista Capehart says some government-issued syringes are not able to pull all available doses from Moderna's vials.
The syringes that we're receiving are going to impact the number of doses you're able to get out of those supplies, no matter the skill and the education and the ability of your healthcare providers.
According to federal officials, at least 7 states have given the first dose of the Pfizer and Moderna vaccines to more than 10% of their adult populations. Meanwhile, an update tonight on the New York Attorney General's report that New York State undercounted nursing home deaths during the pandemic. The White House saying the Justice Department will decide if Governor Andrew Cuomo should be investigated for his administration's role.
Look, whether a person died in a hospital or died in a nursing home, the people died. Everyone did the best they could.
Johnson & Johnson tells CBS News they plan to deliver just 2 million doses of vaccine once they get that emergency use authorization. But the company still plans to supply 100 million doses to the U.S. by the end of June. And Dr. Anthony Fauci says that children will likely be able to start getting vaccinated by the end of spring, early summer. Lana?
That's good news, Mola. Thank you. The race to vaccinate is bringing racial disparities in the U.S. to the forefront. Data from 23 states shows communities who have been hit hardest by the virus are also the ones that are falling behind in vaccinations. Adriana Diaz has more.
Blacks and Latinos are more likely to die from COVID, but less likely to be vaccinated. Early vaccination data shows that Black Americans lag significantly behind white Americans. Take Maryland, where 63% of doses have gone to whites and 15% to Blacks, though they make up 31% of the population. In Texas, partial data shows that 9% of vaccine recipients are Hispanic, though Hispanics are nearly 40% of the state's population.
I do not feel that we in Southeast Austin have the same access to the vaccine.
A disparity Austin City Councilwoman Vanessa Fuentes sees in her mostly Latino district.
We don't have the traditional infrastructure of hospitals and pharmacies.
In addition to less access, vaccine hesitancy is another barrier. Even in healthcare settings, where 37% of workers either want to wait and see or definitely not get the vaccine. And Black Americans are most hesitant. Rhonda Jones is a registered nurse.
What are your thoughts on the vaccine?
I say no. It came out just a little bit too fast for me.
She works at Chicago's New Roseland Community Hospital, where 73% of staff have declined the vaccine so far, despite the hospital's outreach efforts.
Some people might be surprised to learn that you, someone in the medical field, don't want to take the vaccine right now.
Well, I would say that's just me being a good nurse. You have to learn a little bit about it before you do it.
She wants to wait and see. Adriana Diaz, CBS News, Chicago.
For more, let's bring in infectious disease specialist, Dr. Uzma Syed. Dr. Syed, thank you for joining us and for all that you do. Even before we get into the news about Johnson & Johnson's trial data, I want you to respond to what you just heard in Adriana Diaz's piece, that nurse saying that even though she's in the medical field, she wants to see how this all plays out and she is resistant to getting the vaccine. What is your response to medical professionals who are saying they're not interested?
I think this is a fundamental problem that we've been seeing, as the vaccines have been rolled out. And unfortunately, most of us forget that healthcare workers are human beings too. So the same hesitancy that a person not in the medical field may have, a person in the medical field will share those as well. So what we really need to do is invest in, the infrastructure and the education of everyone within and outside of the healthcare system so that they have the facts and know all of the facts about the safety and efficacy of these vaccine candidates and how much was actually put into these trials and how they've really been vetted extremely well and have been proven to be safe.
All right, let's go ahead and start talking about some of these vaccines, in particular Johnson & Johnson. Their trial data shows that the company's vaccine protects against coronavirus with just one shot. How big of a game changer will this be?
Well, any news, positive news on the vaccine front is really welcome right now, especially at this time when it's, quite frankly, a race against the variants. So the more vaccine candidates that we have that have completed their phases of the clinical trials have been proven to be safe and effective, just gives us more tools in our toolbox to really fight this pandemic and really get ahead of these variants. So this news today was really welcome, and we wait for the data, but we're really quite optimistic that the single dose vaccine can potentially be a big game changer in national efforts and global efforts.
I think we would be celebrating that a bit more if we knew that the Johnson & Johnson vaccine was more effective against the variant that was first identified in South Africa. Could this be problematic if the variants identified overseas were to become more prevalent here in the United States? And shouldn't we expect that also to happen, given that everything right now indicates that they are, in fact, more contagious?
Absolutely. This is definitely concerning, but we do know that the manufacturers are really working on these vaccines. We really have to get ahead of this. We know that many of these vaccine candidate manufacturers are actually looking at ways of tweaking the vaccines to be more effective against these variants and future variants. But ultimately, it's a race against these variants. So what we need to do is really ramp up our genomic surveillance and sequencing and really identify these very quickly and really double down. This is the time to really double down on our infection prevention measures and prevent the spread of these variants and really get this mass vaccination campaign underway.
Dr. Anthony Fauci says that the variants found in the UK, South Africa, and Brazil initially will continue to spread in the U.S. until they outnumber the cases of the original strain. But health experts say that the best way for the U.S. to get ahead of these variants is, as you say, to vaccinate as many people as possible. Given all of that, what do you think, first of all, about people who may be saying, I'd rather have one dose or I'd rather have a greater effectiveness against this strain that came from or that was first identified in South Africa, and are trying to now choose which doses or which vaccines they want? Is it more important at this place in the pandemic for people just to get whatever they can get, or should people be thinking about their own particular set of circumstances and seeking out the vaccine that they think best suits them?
I mean, at this point, it's really more of a supply and demand issue, and we can see, with the slow rollout of the vaccines and how much need there is for mass vaccination still, and how the supply just isn't there, and the scale of the pandemic, that we really need to push to get as many people vaccinated as we possibly can to really get ahead of this. That is something that we definitely are going to have to deal with, as we move forward, as FDA does give emergency use authorization to this vaccine, and as more vaccine candidates become available, that will be something that will come up with the general public. But essentially, at this point, it's a matter of having access to a vaccine that can be life-saving and really getting people on board to really have vaccine acceptance and get ahead of this pandemic.
Dr. Syed, the CDC is now conducting research to determine whether wearing 2 masks is better than 1. Should we be doubling up on masks while this research is still underway? And what other ways can we really protect ourselves from COVID, and especially from these emerging variants?
Absolutely. We are seeing now with all these variants that have been circulating, and most likely we will see more of this in the coming days and weeks, that these are, becoming, they are more transmissible. And so what we do need to do is, we know what works, we know that masks work, but we need to really increase, the tools that we have right now. And so we need to double up on these masks. We need to find masks that are better. And these are all ways that we can prevent this virus from continuing to spread while we're continuing our social distancing and avoiding gathering indoors, and creating those really dangerous scenarios. But mask is a very, very great tool that we have and an effective way to prevent virus transmission. So the more data that we have on specifics of masks, we know that not all masks are created equal. So I think that's a message that we really need to get across, is the more layers that we can create, the better we'll be at preventing transmission, especially for these variants that are more transmissible, that are already present here.
So to be clear, your recommendation now for people who are going out in public is double up on those masks?
As much as you can. If you have different types of masks that are available, take a look at the cloth mask that you might have and make sure that the fabric is really, if it's layered, it's better, it's more appropriate. If you have access to a surgical mask, which are sold in stores, and you can use a cloth mask in addition to that. The multiple layers, and any mask that have filters in it, all of those are going to create, more protection, more layers of protection. And certainly if you're going to be indoors for an extended amount of time, you really want to do that to protect yourself and protect others.
All right, Dr. Uzma Syed, thank you.
Welcome.